All right, we're back. Adrienne, thanks so much for coming by. So you're at Banner. First question is just, tell us, what do you do at Banner?
So I'm the Executive Director of Revenue Assurance, kind of the middle operations, also, vendor management and looking at ways to afford healthcare for our populations. So,
our series is about innovation. We've been talking, everything's on the table. Is there anything that either Banner or yourself is excited about, passionate about, from a innovation, whether it's technology or other areas?
So the United States has this big patchwork quilt of healthcare, and we haven't done a great job of making it affordable for everyone.
Yeah.
Most of the other OCED countries, they have higher mortality outcomes and things than we do. So that extends into financing. We have not given our patients a way to afford their care. What I'm really excited about is this journey we're on to find new, innovative ways to cover the cost of care.
Yeah.
Particularly if we get into prevention and we have people financing their preventive care and making it routine, and we can get better health outcomes over time that way.
Yeah.
So it really fits in with the revenue cycle because that's what keeps our doors open.
Sure.
So I like to say the last thing I want our patients to remember is the interaction they had with the revenue cycle. They're there. They're there for the clinician experience, not to talk to us.
Yes, absolutely. Yeah, I mean, it should be transparent in a way, and elegant and clear.
Yeah. Yeah, healthcare's been behind for a while, right?
Yeah.
So McDonald's had the menu where you could look at your order and they'd read it back to you and you could see it on the screen 15 years before we could do that with even drug orders and things.
Yeah.
So we're catching up.
Yeah.
It's taken a while.
Do you think that COVID, folks I talk to, there's so many silver linings in COVID. Was there any that come to mind with Banner?
Telemedicine. And that's the big one everyone's talking about,
sure.
right? We made more progress in 3 months than we had in the prior decade, and we want it to stick. Delivering care right in people's homes. That lower cost care is going to stick around whether the healthcare providers do it or the insurance companies do it.
Yeah. Are there remaining kinks? I know some folks, like from a reimbursement standpoint, reimbursement covering cost is still an issue. Some markets better than others. Like, what are you guys experiencing?
I think providers in general, now that this has opened up, want to be able to work from a beach in another country or, kind of work from anywhere. And there's a lot of nuance to that. So I don't think we have good technology systems right now to handle the billing that's required for something like that.
Yeah.
So
yeah.
We'll have some provider dissatisfaction as we try to work those things out.
Yeah. Or, Banner's known, your vertically integrated system and often a model talked about, like a core model. Is there a notion that, if you will, Banner franchises that model to some extent? Or
there's probably some opportunity there. We went through an extensive modernization that really turned over every corner of our revenue cycle, and now we're in that optimization phase where you're trying to squeeze out that last little bit that's the hardest to capture, and I think that's where we're looking at automation, AI, and ML to kind of help us fine-tune some of that.
Yeah, I know I've gotten to know some of your folks in the revenue cycle, and so there's a lot of opportunity, right? If you go across all those little micro processes. What about in the areas that are under your purview? Is there anything in what you're doing that is like lower hanging fruit than others, or?
There's always charge capture automation and coding, natural language processor.
Yeah.
In the space of making care affordable, there's choosing which payment options to offer to a patient based on their circumstances. You have to be really careful that we don't fall into that trap with AI of building in disparities.
Yeah. It's like anything. You have to make sure that the process on your process engineering achieves your goals before you start applying the technology.
Yeah, you don't want to pick up a pattern of somebody writing off claims that we should pursue and then have the AI write them off.
Yeah, exactly. Talk about an unintended consequence. What What else do you think should be disrupted in healthcare that maybe doesn't get as much press?
I think the preventive care model has to be disrupted. Telemedicine was a good start.
Yep.
I know that I like to use telemedicine for as much of the visit process as I can. I'll go into the doctor if I have to, but there were models before the pandemic that were working really well,
Yep.
and we need to continue developing those. I mean,
Yep.
we don't need an office visit or a hospital visit for every service. We need to
Yeah.
come up with other cheaper methods of delivering care.
Yeah.
There's a healthcare shortage in this country.
Absolutely.
If you give everybody access to the best health insurance and make care completely affordable, we still don't have enough providers to provide all of that care.
Yeah, that's a really good point. In the jobs to be done, we use that, jobs to be done in healthcare. You could go from clinical care to shopping for healthcare to delivering an elegant billing experience. There's so much that has to get accomplished, but that also creates the where do you start? How do you? So how? One of the questions I love to understand, how do you get things done inside your culture, incremental, big bang, combination.
It is a mix. I tend to prefer incremental myself.
Yeah.
I think our system is so entrenched in the way that it's built today that incremental gains are the best you can do, but there are opportunities for big bang. If you're spending a lot on a technology footprint, I think that should be a big bang. You should not just dip a toe in that. It's too expensive.
Yeah, there's certain things if you're going to implement a new EHR or something it takes time, but you have to do it with some force, right?
Yeah, and if you're buying something you don't intend to use for more than 2 or 3 years that has a short return, that needs to be a big bang. So.
Yeah. Well, what about, the pruning, the concept of projects get funded and then they kind of, in some cases, just develop their own life. How does your organization go about making sure that you also prune things? Because we should be creating a fail fast. If you're really innovating, we have to get over this fear of failure, think like Silicon Valley. So, but not every project's going to have legs or the potential that you thought.
Yeah.
So do you have a process to do that?
So you're thinking, what's that next failure point after the go, no-go decision where you move it forward? Yeah, we evaluate our projects continuously for return. So, we put together standard term sheets, roadmaps, monitoring tools, and if something's not working, we course correct.
Yeah.
Can't be afraid to execute on your SLAs.
Yeah, sure, absolutely. How much do you think, if we go out 3 or 4 years and you say, depending on what report you read, there's $500 billion of waste in healthcare across the gamut. Did COVID, or is there, you can kind of feel an energy that people want to, especially because of the Great Resignation and speaking of jobs to be done, a lot of those positions, the point you were making earlier, are not getting filled, right? So we have a supply and demand. So technology seems to be people are investing because they have to. To what degree is that going on at your organization?
I think it's expected. I mean, we have to have a certain level of technology just to meet consumer demand. We try to meet our patients wherever they want to be met, whether it's an app or a phone call or a web interface, but we have waste across healthcare, period. If our providers spent less time documenting, they could spend more time providing care.
Yeah.
If our billing office and revenue cycle teams didn't have to spend so much time on the back and forth with insurance companies, there'd be savings on both sides, which then could be passed back to the patients and consumers. So we need to find ways to make smarter decisions and leverage all this information that we've built up. Every health system has a data lake. I want to see that data lake producing a return.
Yeah. Well, yeah, because you can centralize data. This is what we do you can centralize data, but if you haven't really thought through how you're going to take action on it, right? That's the most important part that sometimes gets overlooked. So do you feel like we'll have a leapfrog moment in terms of tackling innovation because we have to some degree?
Yeah.
Like we talked about it being healthcare, we all know it's like behind, but are we looking at a leapfrog moment in the next 3 to 5 years?
Yeah, I think so. One of the things I'm focused on with my tech partners and physicians and researchers that I work with right now is turning an ML project into a business plan so that you can move it forward. I work with a lot of researchers and they always come up with these great ideas, and it's great to publish a paper or complete a study on something, but then to figure out how to turn that into a business plan that actually impacts your health system or your patients is a lot more challenging.
Yeah. So that's a great one. That happens a lot in research facilities. So how do you solve that? Like,
you have to teach the people who are handling the tech how to pitch an idea and how to understand a return on it. So.
Yeah. So you have a background, I know, in finance and accounting, and so do you actually do that? Sit down with folks that, hey, whether you run a net present value or discounted cash flows, like there's different models, payback model. Do you provide the training that people have to start to say, like, you want your project, but you got to have a return, and we're going to manage and measure?
Yeah, I do. I've done it as part of my role over the years, but right now I'm more proactively doing it. I'm working with physician groups and physician leaders to try and help them with that piece of it.
Yeah. And you have the qualitative side of it, right? How is this going to move the needle on something like patient engagement? But then there's the pure quantitative side of it. What else should I ask you that I haven't asked you?
Health equity is a big deal right now, and that does extend out into the revenue cycle realm, right, to make sure we're doing the right things for all of our patients wherever they're at. And so I'd like to see more focus on that in the coming years.
Yeah. And you have, like, to what degree will technology play a role versus a lot of that is a marketing and communications thing, right?
Yeah.
How would you carve that up? Marketing, communications, preaching the gospel, so to speak, versus using the tech to execute?
I think the tech should just be there to give us information and let our teams make the decisions. And I think we could do a better job at delivering information, just making us aware of circumstances or,
Yeah. So go out to 2025. Final question.
Okay.
What would you be stoked to have accomplished by 2025? An initiative, a project?
Well, that is a tough question. I would like, honestly, charge automation to be fully resolved for Banner. We still...
That's a great one.
Yeah, that's one that's actually in my scope, and we're constantly working on it. We've made a lot of progress, but there's still some areas where it's harder to get that done. And I want our team members to be working on quality assurance and training clinicians and working with them on how to get it right in the documentation phase and not keying charges. We want to get people to the higher skilled work that's more engaging.
Yeah.
So.
Do you feel good about it? I mean, that's a great tangible charge automation, right? That's a tangible thing.
Yeah, we've made a lot of progress toward that, and as we continue in our Cerner implementation, we'll see that continue to grow. So there's still opportunity, of course, but for Banner, that's what I would hope in the next couple of years we can really accomplish.
Well, I know that we're going to share a cocktail, and we'll toast to that.
Okay.
To charge automation in 2025.
All right.
But I just want to thank you for hanging out and joining the fun today.
My pleasure.
Really appreciate it. All right.